My name is Dr. Teresia Wangari Kang'ethe. I am a dentist with special interest in pediatric dentistry and orthodontics. I am the owner and practicing dentist at Smiles and Grins, which is on Feruzi Towers, Kiambu Road. And today we're going to talk about dental braces. So once we are ready and we find that now we are ready for your orthodontic treatment, we usually start by doing what we call study models. So study models are a replica of what you have inside your mouth that we keep as our records on the outside of the mouth. We get them by doing impressions of your teeth while you're with us on that very first visit for doing the braces. Apart from that, we usually do some intraoral photographs. That's the photos of your teeth, your gums, before the treatment begins. These ones are usually just for a record for both of us as a dentist and also the patient, so we can keep referring and seeing, okay, are we going where we would like to go? Mostly because orthodontic treatment is really, really slow. Other than that, we take extraoral photographs of how your face looks like, your facial profile, smiling photos, just to also have a record. Once we're done with that phase, we will send you for some x-rays. Usually the x-rays we will do in most cases are 2 of them. One, we call it the orthopantomogram, the OPG. It shows us all your teeth, all the roots, so we can be able to discern if there are any abnormalities in your bone, anything we might have missed in the roots of the teeth. Apart from that, especially in the growing patient, we're going to send you for another x-ray that we usually call the cephalogram. Now, its purpose is for us to predict. It helps us be able to do some mathematics and predict where your growth is headed, how your face will come out of the growth phase. So that way we try and keep our alignment in keeping with where we predict your growth will go. Then once we've done the x-rays, usually there is a phase of treatment planning now. This one is done by the dentist without you in the office. They do an analysis of the study models, something we call space analysis. They do an analysis of the x-ray, especially the cephalogram, and combine those two to come up with the most ideal treatment plan for you. In most cases, there'll be about 2 or 3 treatment options that the dentist will have. Then when you come in for your treatment discussion appointment, we are going to go through the 2 or 3 options that we have. Then together with the patient, we'll come up with what looks most ideal for the patient. This is because as we do our analysis, there are things that we'll find, like, let's say my treatment plan is telling me I might need to remove some teeth, but my patient is not comfortable having teeth removed. Things like that, there's always an alternative that you can discuss with your patient. Part of why we have different treatment plans is sometimes they involve things that require consent of the patient, like extraction of teeth, and say the patient is not comfortable with having teeth removed. So we usually come up with several alternatives and we discuss the one that is the most ideal. There are some times when there'll be no option, to achieve the best results. We'll have to tell you, okay, we know you would not like to have this, but this is the best. And you can agree with that with the patient. And once you agree, then you come for the first appointment stage for fixing of the braces. Now, this really depends on the practitioner. There'll be someone who will fix both the upper and the lower jaws at the same time. Most practitioners will fix one jaw, maybe the upper jaw first, give you some time to get used to having braces in the mouth. Then once that is done, they can fix the lower jaw. There's often a question of how do braces feel like once they're placed. Will I have pain? Will there be discomfort? Will I be able to eat? Will I smile? Will it pinch my cheeks or things like that? And we usually say that in that initial appointment, a bit of discomfort is expected. This is mostly because the teeth are having some movement they're not used to having. Usually you'll have the maximum discomfort at around day 3, day 4, and that's when now the teeth have started moving in the course of the treatment. How we mitigate that is we actually recommend taking some painkillers if you need them. And also, as we fix the very first time, we keep our forces at a very, very minimum, the lowest amount of force that can possibly be used. And that is usually by just using lower gauge wires, avoiding the use of any elastics that tie the teeth together in that first appointment. As to the pinching of wires, sometimes pinching of wires is unavoidable because you'll always leave some wire, especially at the back. So how we go around that is that we usually give the patient some wax that when they feel as if they're getting pinched, they can place over that area at the back. though we also try and keep the amount of protruding wire to as little as possible. The overall feeling on the inside of your lips and your cheeks, it's weird at first. It's weird at first because there's some small protrusions on your teeth that someone is not used to having. But it's one of those things that after a week or two, you barely notice that they were there. We actually get patients who ask once they've removed the braces, they feel as if something is missing and they need it back or something like that. Thank you for joining us in this discussion. You can book our services at ponea.com. We look forward to engaging with you more in our coming episodes.